All right, Dr. Emer, in 3, 2, 1.
Hey guys, we're here from New York and we're doing plasma pen. My patient is absolutely doing amazing. She's already done some deep microneedling radiofrequency and now I'm focusing on plasma pen. I really want to tighten her under eye skin. I'm actually going to do this and then do a rollover probably with the clairvoyant. I haven't decided yet. But right now, I mean, we're just doing the tightening and this is also going to brighten the skin because each of these little dots obviously will scab off and then tighten the area. You okay? She's doing great. She's a trooper, you guys. She definitely, everyone feels plasma pen, but they survive. Always looks great afterwards, especially with the right skincare. So this is where you don't even touch the skin, you guys. You literally just go real close and energy is delivered into the skin precisely in microseconds to be able to get it to tighten up. And I'm going as close as I can to where she's comfortable. I'm trying to go all the way up. You're doing great. What are they saying?
Let's see what people are asking us. Some people waving at us. Nice of them to join us again. Good caring job. Let's see. We have a lot of people are just joining in right now. He said very good. What is he doing?
So tell them, why don't you guys tell them rather
Guys.
than me? Introduce who's here.
Right.
Lauren.
In our
Introduce
office.
yourself, you guys.
In our office today, we do have Novik.
Yeah, you guys
Over
introduce
here.
yourself.
Hey guys, I'm Ina, and Dr. Levenstein is over there as well.
Talk to
And-
Mario. Who are you?
And we're in Doylestown. We're Navy Medical Aesthetics, and we actually partnered up with Dr. Emer.
Talk
And
loud so they can hear you.
we partnered up with Dr. Emer,
There you
and we
go.
are learning all the best protocols from only the best Dr. Emer.
Exactly. And so tell them about plasma pen because you guys do this.
Yes, we do. We do plasma pen, which is amazing to tighten the area under the eyes because it's so difficult to really
Now you
get
can do
them.
this in other areas around the mouth,
Yes.
elbows and knees. I just did vaginal tightening last week. I didn't show it on Instagram, of course, but we do that too. There's a lot of things you can do with it. This is a good alternative to laser so that you don't have to have as much downtime. And it still gets you a really good selective degree of tightening. For her specifically, it's gonna be really valuable. She's gonna see a pretty significant change because we're going all the way up directly under the lid.
So asking, how much is this treatment? One of our most
Tell him,
favorite
Jordan.
questions. And I can answer that for you guys, but I'm not going to give you a price. If you do need to book a consultation, you can DM us with your full name, email, and phone number. Or you can email appointments@jasonemermd.com. We are happy to reach out to you. Do give us 24 to 48 hours, please.
Because we customize it, you know, depends on what we're doing. We're doing other lasers, I mean, skincare, there's things that we can do. We'll go all the way for her up to the corner. Sorry, honey. There we go. Good, so you guys see we're really reaching all the way up.
And they're asking, is it painful?
It hurts a little. You can see her flinching slightly. You can actually do nerve blocks, but since she's taking a train, I don't want to do that for her. So it's just kind of get through it really quick. She's got cold air. We put numbing on there the best that we can. How does it feel to you, like on a 1 to 10?
3.
And that's not bad, actually. And that's really reasonable. You see, I went all the way up. I'm also getting the crows. So I like to actually tell people to put Aerify from Emerage Skin on top of this right when it peels, because the skin will blend really well, or Cosmolon 2 cream. And then there's a very detailed protocol I have on how to make this heal quickly without lumps or bumps on the skin. using our stem cells and our growth factors, hyaluronic acid, vitamin C. So she's basically going to do everything. We also did tightening on the rest of her face with Morpheus.
We have another question. Does it help dark circles?
Yes, it does. But remember, tell them, you guys, what's the cause of dark circles? Is there an individual cause?
Multiple.
Many causes. So the thing is, it may improve some of color and tightening, but it's not going to improve hollows, and it's not going to improve bags. So, you know, you may, I don't know, I can't tell you the answer unless I see you.
But Emerage Refit Eye is amazing for dark circles.
Yeah, tell them about it.
We
You
love it. We love it. Everybody that's been using it absolutely loves it. It makes such a huge difference. I love having my clients started right after Morpheus and Skin Pen. They get amazing results.
So we're gonna now reach around that crow's feet. Have her use the cold air. And then what I'll do, if you guys can clean off the upper lid. Sorry, honey. We're getting the crows and I'm doing my best to keep it as fast as possible for her. See how we're very meticulous. Come from the other side, from the other side.
And for those of you joining, asking what we're doing, we are doing plasma pen. This is a non-surgical way to tighten the skin around the eye with minimal downtime compared to doing surgery.
And then if you do one more alcohol on there.
Dr. Emer, can you please tell us about the downtime on this procedure?
So it depends on how strong we go with the plasma. It's going to be about 3 to 5 days of her having some scabbing and peeling. And since we're doing the upper, she's probably going to have a little swelling as well. And then that's it. And then it's going to look a little red and kind of dotty for a week or two. Mostly people wouldn't notice it. And then then she'll look brighter and it'll look tighter. I always tell people when you first do this, it's 2 or 3 times in the year to make sure it's close to what you want to get. And then you can just maintain.
And if you guys do want to see what our patients look like directly at one day after, we did do a live yesterday of a patient who we did this in the OR for.
Okay, bear with me. You should actually do pretty well. I'm just going to do it so you can feel.
We ask our patient
Okay.
what is the pain level you're having?
About 3 to 5. It just depends. Mostly 3.
Depends on the area. Mostly a 3. She's a very strong woman. She's got grandkids and dogs, so she can survive this for sure.
Yes.
But she's got a lot of love and a lot of strength.
And we do have a loyal viewer who's tuning back in from this morning.
Oh,
He's asking,
what are they saying?
is this the treatment under the dark circles that you were talking about this morning?
I was. Yes, I was. Good job for remembering. This was the exact treatment that we were talking about for the younger male this morning. Use the cold air a little higher. I think it'll help you. Yeah. And I was saying this would be great for him under the eye. For her, we're doing her whole lid because she needs more tightening.
What is
Cooling's
the recommended aftercare?
Well, that is at emeragecosmetics.com. We typically have people use Silogen twice a day, anti-age serum twice a day, Emerage Skin, Refit Face and Eye, and then exfoliation cleansers. She's going to have all that anyways because she's doing it from Morpheus. So we have a whole protocol. If you want it, contact us. DM us or go to emeragecosmetics.com and go to the non-ablative laser package. But we can go through it with our skincare specialists.
If you guys do need to book a skincare consultation, please DM us your full name, email, and phone number. We do have several great options for consultations.
You're doing so good, and if you see close enough, just pulling on you, I'm sorry. It's a little bright.
Hello, Germany. Germany is saying hi to us.
Hey guys from Germany. So I love my East Coasters. They're like the strongest and determined and loyal. Look at how good she is. We're almost there. We're basically done with her whole left eye. You guys see we've done like 1,000 dots. Anything you want to say over there, Novi? Jean?
We should have a prize for someone who can count
What?
how many dots she has.
Oh my god. That would be a giveaway. If someone could guess the exact number, give them all Emerage skin line.
Okay.
Could you imagine? I don't even know.
I'm gonna start counting.
I'm not gonna count. Jordan's
For
gonna count.
Emerald
I'm gonna
line,
count.
I'm gonna count.
Yes.
If someone's been watching us the whole time, please let us know the number we've done.
If they can actually tell me the exact number, I will freak out. Because that is, I can't tell if that's a loyal fan or a stalker. Okay? That's what I have to say. Alright, we're basically done. I'm just filling in the blanks right here, this last portion.
You're doing great.
And you see how we're going all the way down, very close to the lash line. She actually doesn't really need directly on the lash line.
How many treatments will be needed to show results?
You just said, you guys, were you listening? I said 2 to 3 treatments in the first year.
Okay. And is there any level at which you would recommend surgery to have excess tissue removed?
Yeah, you can have surgery anytime. It's just, you're still gonna need to improve texture of the skin no matter what you do. So this is also, even when we do surgery, I often will combine this with the surgery.
Someone said, I'm from South Carolina. Would you recommend a series of these?
Yes, come see us. We could do it here or in LA. Tell how to make the appointment.
If you do want to make an appointment with us, we can book you on the East Coast at our next New York trip. Or you can come to LA and visit us. You can do that by sending us a DM with your full name, email, and phone number. Or email us appointments@jasonemermd.com.
I'm gonna tell you guys we're almost there, and then I'm gonna show you the dots. Such an amazing, amazing patient. Okay, I'm gonna do one more row. Hold still. Doing fantastic. Alright, let me see you straight for a second. I'm going to go one a little bit higher over here, hold still. And I made a promise.
Local anesthetics, question mark. Yes.
Yes.
A
you have
patient
to
is
use
none.
topical. So the one thing I told her I would do was do a little bit on this wrinkle of her forehead. So there's a wrinkle here. So what we're going to do, we're going to go right over this wrinkle on both sides of it, okay? And what you try and do is blend it a little bit. Now, do a little bit as well on the crease. Alright, so that's, I want to show you, that's what I wanted you guys to see. So you can see this whole area is done. I'm a little bit higher for her, but I want you to zoom in, show them the dots, Jordan, and then I can keep going or we can end. It's up to you, you can tell me.
I think we're good. Let's just show them one side done, one side not.
That's great.
And then we'll show them her afters. We'll follow up with her and keep track of her progress.
I did this exact treatment on a very similar patient for the doctor's show. It's on YouTube. She was so thrilled with this treatment. So I'm very excited because you guys have like exactly the same. Perfect. So use the cooling on this side now. Show what the bottom of the other side. You could show them the dots up close. And go a little higher on this one.
This treatment is amazing. Patients love their results.
Guys, what you guys did just watch was plasma pen. This is a non-surgical way
I'm gonna start on the
to
other
tighten
side
the skin
now,
of the
okay?
eye. Let me show you guys both sides.
Hold
This
on.
is one side that we have done. You can
Swipe
see
up
all
one
the
time.
dots.
You know
And
The
on
what?
lower,
this
yeah,
side,
just the lower.
we do have no dots. We're just wiping off numbing. About to get started there. Okay, and thank you for tuning in.
Thank you guys.
Thank you guys. See you soon.